Good evening. I didn't see you come in. Hello. My name is Dr. Andrew Michaels, and I'm here to help you. What seems to be the problem that brought you here? Okay. Yeah, that's a common problem. I think I can help you with that. No, no, no. Absolutely not. It's nothing to be ashamed of. Everybody has these problems. Why? Just the other day, I had a very similar problem myself. Infection. We all pick up infections from touching dirty sinks to, toilets, public restrooms. And of course, children, they go to school, they touch everything. Everything's either on their hands or in their mouth. It's very easy to pick up germs. And infections aren't far behind. No. Well, let's just take a quick peek. Let's just take a look. Yes. Just open up real quick. Just want to take a quick peek. Ooh. Oh, yeah. Yeah. Let me get some gloves on. I think I see the problem already. It's not the problem you think it is. I like to mix things up and I don't want to tell you exactly what I think is the problem just yet, till I know I'm making the proper diagnosis. But let's see, I think this one will work better. Could you please open your mouth one more time and just let me take another look. Oh. Yeah. We definitely have a problem in the back of your throat. We're definitely gonna have to take care of that. What has happened is they call that a tonsil stone. And what it is a very foul smelling piece of leftover food that has been lodged in your tonsil area. And what we'll do is we'll squeeze the tissue, eject that material, and pull it out. I'm just going to take a further inspection. I need one of my mirrors. So let me take a quick look. And then we're going to give you some mouthwash to help you heal that area. No, you won't need any medication at all. Let me take one more peek. Just want to look behind. Yeah. Oh, that's definitely it. This is no problem. Would you like me to extract the stone? Only take a moment. I use my mirror to check behind the tonsil, and what I've noticed is if you just take the mirror, not a poking device like this pick, but a nice soft gentle curved surface like this, and you press on the tissue, the stone will pop out, and then we just scoop it out and remove it from your mouth. And it's totally painless. Something like this, if you pick at the area, you might cause bleeding, future infection, and we don't want that. So let's just really quickly just use a tissue with some alcohol. That's right. A little alcohol cleansing on the mirror. I want to put it in your mouth unless it's completely clean, because we're going to be touching your tissue, not just examining. My tools have all been clean, but I want to doubly make sure that they're very clean. Okay, let's get that stone on the right. And what we're going to do is just press gingerly on the back side of the tissue until there it is. The tissue releases the stone. It popped right out. It's very painful, I know. Touches the back of your tongue. And I will scoop it gently up, and we will remove it. There you go. It smells atrocious. Absolutely foul. And we will push on the tissue just to make sure we got it all out. And I believe we do. Oh yeah, we've got it all out on the right side. Now if you'd like, we can get it out on the left side. Would you like that? Okay. And we gently go inside your mouth. Press on the back side of the tissue. Oh, there it is. Now try not to gag. And get the stone out. This one's rather large. And then we scoop it up gingerly, and we remove it from your mouth. Clean off the mirror. Yes, it's very pungent odor. It's rotten food, and then the rotten food causes pain. But I can tell already you can feel the relief from having it removed. Okay. I was in a hurry. I didn't. Tools are moving around on life of their own. I want to check one more time on the left side just to make sure that there's no further materials. There's a small one. Good thing we went back and double checked. And we will just slide up and take it out. And there you go. One more triple check on the left side. And just to be sure. Very clear. And the right side. Your tonsil area looks perfect now. Very good. Very good. I'm very happy with the results of this procedure. Snacks, breads, different foods like that get lodged in the back of your throat and your teeth. Once they hit the tissue, they start to bore a hole in. That's where the stone comes from. A lot of people walk around with pain because the stone eventually touches the back of it. You know, the tonsil becomes swollen and pushes. You can already feel the swelling going down. That's good. And as the tissue swells and the stone protrudes, the body's trying to reject it. There is a potential for infection. And I know it's very important in your case not to have any kind of infections in your mandible area. There we go. Just double checking the structure. Looks very good. Yes. And of course, when it touches the back of your tongue, it feels swollen. You feel like you have an infection. It's very troubling. But I've seen people do things like stick a sharpened pencil in the back of their throat to try to pull the stone out. And you can poke yourself and cause bleeding, like I said, infection. It's very dangerous. Some people use a sharpened screwdriver, but the best thing to use is something very dull, smooth surface, and press on the tissue, on the back of the tissue, like that. You know, as you're looking in a mirror, and the stone will come forward, come out of the hole that it in your tonsils, and then you can just gently brush it out or spit it out. If it lands on your tongue, in this case, I removed it for you because you had a tool in your mouth. I didn't want you to get hurt biting down on a tool. Yes, very good. Okay. I just want to write a couple things down for my notes. Patient's notes. My pen just gave out. Look at that. You'd think a doctor would have, access to good office materials, but it's got a ball in it. Let me take this thing apart. How does this thing come apart? Oh, there it is. There's plenty of ink in there. Why did it stop writing? Let's try it again. We'll just put it back together. There it is. It's writing again. Look. It stopped again. I swear, I have the worst luck with my office tools. What's that? Yes. Just trying to fix my notes. I'm just about to fall off my clipboard. You would like to keep them? They're just on that tissue. Yes, you can. No, I was, my pen started working. I was just writing some notes down. Sure, we can do that. Take a break from writing, and yeah, I'll just wrap those right up for you in this cloth. They're from your body, yes, I understand. Wrap them up nice and tight. Put a string on them a little bit. Just keep them sealed up. Very putrid smell. Okay. And then I suggest this mouthwash. Here you go. Here's the stones all wrapped up and ready to go. Back with you. Very good. And here's some mouthwash, just a small trial size. This will help you prevent that. Clean the area. And it should relieve some of the pain in the back of your throat when you gargle with it. If you don't mind me looking at since I have your... No, you don't. You're welcome to refuse my services at any time. But I was just noticing this small spot above your head here, and this small spot here. And I'm not sure about this spot. Oh, I know, it's so hot in here. I'm sweating profusely myself. Would you mind if I took a small tissue sample of those? You would. Okay. And no, you can refuse my services at this point. I'm sorry if I offended you in some way. No, I'm not offended. It's rare that somebody refuses medical treatment. You feel better. I can tell that you're relieved from the stress of the tonsil stones. So if there's some religious reason or cultural reason that I've offended you, you do not have to disclose that to me. It's really none of my business, but if you feel the need to talk to me about it, we can discuss it. Oh, okay. No. Well, yes, that's an issue. Excuse me just for a second here. Get a tissue. I'm so... If I wasn't hot, I am now. No, that was not a... Why would that be a sexual procedure? What just happened? Checking your mouth? Removing food from the back of your throat? Okay. And who told you that? Okay. No, I'm not writing anything down right now. We're just gonna talk. I think we need to have no, you can't get pregnant that way. No. You saw a video. Okay. All right. And the man, no, you can't get pregnant in your tonsil area. That's totally fabricated pseudoscience. No, I don't think you were mouth raped. I don't take this subject very lightly, or I do take it very lightly. I don't take this lightly. I'm being dead serious. This is very important to me. And if somebody told you that you can get pregnant that way, oh, okay, well, everything between the doctor and the patient is confidential. It is. Okay. More than likely, if you were pregnant from anything, it would be from the Ruffles potato chips that you had as a snack 3 days ago that caused the stones. I don't think it was anything else. Well, believe me, this is very uncomfortable. I have good bedside manner. I understand everybody's different. Everybody has a right to their own thoughts and opinions. But in this case, I think as your physician, I need to clarify a few things. I have some diagrams. I could put them up on the board over here, and I could point some things out. No, I'm not writing anything down. Nobody would believe me anyway. Okay. So, without, well, you're old enough that you should know, and it's amazing the public school system has failed you in this way, but when I find out that family has also colluded with the failed public school system to enforce these feelings, according to you, you could get pregnant off of a toilet seat, and that's not the case, and certainly not from a swimming pool. There has never been a recorded case of a human birth of a pool baby. I'm pretty sure. I could look it up. Yeah, I could look it up, but I'm pretty sure nobody's ever had a offspring from a pool baby. Oh, your sibling has, your sister has, because that's the only way it could happen. Okay, all right. Okay, and how old are you again? All right. No, these things do happen in life. Okay. Looking at the diagram, well, the first thing I'd like to point out is this little torpedo-looking thing, snake-looking thing with a tail on it. It looks like a little missile with a squiggly tail. A child's toy almost. This is a sperm cell, and this big round thing is an egg. Now, the women have eggs right here. And the men have these lots of these, like millions. Women only have one egg every month. But the men have millions of these over here. Like, just gobs of them. Sometimes. It's very messy. Do you have time for this? Or if you have to go, we could do this another time. I could schedule an office meeting. Yeah, okay, great. I didn't. Sure, your time's, yeah. Right now, best time to do this. Yeah. Just get it out in the open, right? Okay. Now, these little things and the big egg, they don't last outside of the human body, outside of the fluids and the safety and the temperature and the acidic content, alkaline content. Everything matters. If anything goes out of whack, these things start to die very quickly. When they're exposed to air, they die very quickly. That's why the human body is an internal union, not an external one, like in some animal species, because we want to preserve these items and make sure that they stay alive as long as possible. And they go up inside these tubes to where the egg is, and they join together. One of them penetrates the egg's outer embryonic fluid, the shell around the egg, just like a bird's egg. And when that happens, then a female of the mammal species, mammals like cats, dogs, people, gets impregnated. Okay? And it all takes place, if you look at the anatomy pictures I'm showing you over here, and then the anatomy pictures over here. These ones right there. That's the only way a person can get pregnant right there, is if those two things right there. Yeah, then that thing. Well, they always show it that way in a picture, don't they? It's, it's wishful thinking on some people's parts, but you get the idea. And they have to go together like, like a plug. We don't know. I don't have any of those videos. No, man, we're not going to look those up. But you take a plug and you plug it in the wall. You know, you got there's the wall, and then there's the two prongs, and you, like an electric bulb, yeah. And if you plug it into the wall socket and the light comes on, the light bulb turns on, well, that means the electricity went up the wire, the tube, to the bulb, and you're pregnant. You're preggers. Yeah. I turned my time in. I was going to do a video today, and I had no idea that this was what I was going to do. No. Mm-mm. I'm as surprised as you are that this is the fruit of my labor. Yeah. Well, you never know what kind of an office visit you're going to get. Like I said, everybody's different. Nobody's exactly the same as the next. So don't be ashamed. Hey, it can happen to anybody. So you still have, well, yeah. You have that part. Yeah, so yeah. So without giving too much away, yeah, you can't get pregnant that way. Yeah, because it's the wrong thing. Yeah. No, I wasn't making a joke about the Ruffles chips and the peanut butter sandwich and all that. That is probably how you got the stones in the back of your mouth. The tonsil stones. Yeah. Yeah. So, well, you can throw them away if you want to take them home. That's your property. You're right. I have no right to it. I understand if you want to go home and check a few things out. Have you ever seen my friend Dr. Freud? Would you like, you don't want to go see him? Okay. You're busy with, okay. All right. Well, no. I think you've got a lot to digest today. There are plenty of books that can help you with this. I'd prefer you do not tell your family that I was the one that showed you these diagrams, because obviously there could be some miscommunication in the telling. You know, this is confidential, you know. You as an adult at your age have a right to this information. And, well, I'm just writing down a few notes for future visits. Nothing to do with today, you know. Yeah. And, yeah, I feel pretty good about the whole thing. Yeah. No, so you know for a fact that has never happened to you, what we just talked about. Well, it would be hard to accidentally do it if you didn't, you know how or have any proclivity towards it. Like if you weren't going in the right direction, I guess is the right way to say it. No, you know, I had a patient once, and his mom wanted me to discuss sexuality with her son. In this case, it was a boy, and he was a grown man, actually. He was about 19, college, and she was afraid that he was going to be something he wasn't, and that she wasn't comfortable with. And he had some gender issues, he had some sex issues, he had some identity issues. And I sat him down and talked to him, and I said, you know, the evidence is out there, and you can look it up for yourself. But my opinion on the matter is, as long as you're careful and you take care of yourself, I think you can live a normal and healthy life, and a normal, healthy lifestyle. But that's up to you. If you choose to live a more reckless lifestyle, it doesn't matter what kind of person you are. You're tend to get injured and sick more often. So I think being safe and being careful with yourself, being honest about your sexuality is a way to live a full and good life. Good for you. Yes, good for you. And mom and dads don't always like their children or their adult children to know where the babies come from. And they tell them that, or even the girls or the boys say, well, I didn't do it. It would come from a toilet seat. It come from a swimming pool. That's not true. These things are just fairy tales. You know, yes, that's true. We won't even go there. We won't even go into that part of the joke. But if nobody from that part of the country is living there, it is very hard for that to get through the sewer system into the pool. So we pretty much know the pool baby thing is a total fable, right? And it doesn't make your sister less of a person. If she needs a visit, we can have a consultation with her, and you can, sit in for part of it so we can clear the air. Okay. All right. No, you're fine? Okay. Good. You're fine with that. Okay. Very good. Okay. So, I think we've got it all sorted out, and I really appreciate you stopping by my office today. As I said earlier, my name is Dr. Andrew Michaels. Okay. And, yeah. And, I'm here to help you. I'm glad I was here to help you. Straighten that out. Okay. No, you can, they're right there. You can take them and you can go. Yeah. Okay. Don't feel bad. Okay. Oh, no, I'm sure the nurse can show you out. I'm just going to write a few things down as you leave. So, and until I see you again, please have a most blessed day. Okay. Bye-bye. Bye. Okay. Parents think it's funny or they think it's righteous to hold information back from their kids. As a father of 3 boys and girls, I think it's important that we, and I'm not preaching from the pulpit here, I think it's very important that we don't leave things that are life-changing events up to the mysteries of science. And we are very clear on the natural capabilities of human species, because the human beings are very capable of committing natural acts with or without that knowledge. So I think it's important that we help the younger generation make the right decision with the right knowledge. There you go. Okay. I hope you enjoyed this silly video, and until I see all of you again, as I said earlier, please have a most blessed day. And know that I love each and every one of you. Bye-bye.